Ladies and gentlemen, welcome here at the National Press Center, and thank you for accepting our invitation, the invitation of the Global Commission on Drug Policy. I have the honor to chair since the spring. Our former president was President Fernando Henrique Cardoso de Brazil. It is my pleasure and my duty to present first my fellows here at the table in the order in which I will give the floor to them. On my left, Michel Kazachkin is a physician. He has worked, I would say, all his life in fighting against the AIDS epidemic in France first and worldwide as a former director of the Global Fund against AIDS, malaria, and tuberculosis. On my extra right, you have the President Cesar Gaviria, former President of Colombia. His experience with drug issue is a very painful and difficult one because he was president, I would say, at the peak of the violences in his country linked with the war on drugs. On my right here, Pavel Bem. He's the former mayor of Prague. He was also an MP in his country and very active in the transition. His experience on drug issue is that he was instrumental in the city and in the country for the most radical reform on criminalization or decriminalization that we have in Europe. So he has this experience. He's also a physician and has also dealt with this issue as a psychiatrist for the beginning. And on my left, we have Paul Volcker, former president of the Fed here in the USA. His experience on drug issue is, I think, just the concern of a citizen that is really concerned for the use of this country, and also as an economist who sees the problem of illegal markets and the economics of drugs. Let me just first introduce now the Global Commission on Drug Policy. It's a group of 23 members. 9 of them are former heads of state or government. Kofi Annan is a member. We have a large range of people who have had responsibility and leadership in the world and are committed to advocate for changes in drug policy. Some of us have experience, as I could present my fellows here. Others feel really that this problem is a very important problem for all societies and is a problem that is really horizontal, a problem that is touching all aspects of the life in society and not just an aspect of repression or public health, but that it is touching really the cohesion and the issues of freedom and responsibility of the states and of the individual. The Global Commission on Drug Policy began its work 6 years ago, first with the ambition just to break the taboo, to make it possible to speak about drug policy, about drug reform, and to look for a more humane but a more evidence-based policy. Our activity followed with, on one side, writing and publishing reports on different aspects of drug policy and the effect of failed prohibition. We advocate also on national and regional level to accompany and to help to reform national policies and to bridge also between NGOs and authorities and help the conversation to take really place that is necessary to confront the reality. We are here in Washington to launch our 6th report. This report is focused on the problem of criminalization and decriminalization of consumption and possession or other preparatory act for the own consumption. We think that after having developed the aspect of public health and individual health, it is very important to focus on the fact that the main obstacle to health-oriented policies is the criminalization of the consumers. And this is the reason why our report now, we have the honor to present here, is on decriminalization well understood. I give the floor to Michel Kazachkin about the effect of criminalization.
Thank you very much, Ruth, and good morning, everyone. Thank you for coming and thank you for listening. It's been, let me first say that it's been the view of the Commission, the strong view of the Commission from the very beginning that prohibition and prohibition law enforcement have failed and have failed on the own terms that these policies had put to themselves. More drugs are produced, drugs are more easily available, cheaper, new drugs come every week on the market, and more drugs are used. And in addition to that, prohibition has generated a huge illegal market of several $100 billion that, as you know, threatens development, threatens security, fuels violence and corruption. Within that sort of frame of the failure of prohibition and prohibition law enforcement, this report, as Ruth just said, focuses on criminalization. And what I'd like to do is to briefly outline some of the harms of criminalizing drugs. As a physician, I'll start with the fact that criminalization of drug use has threatened and continues to threaten worldwide public health safety. The fear of arrests, the fear of repression has really led people to hide, to go underground, to inject in unsafe conditions, and that has fueled the AIDS epidemic worldwide. It has fueled a hepatitis epidemic. It has significantly impacted on the risk of tuberculosis in many places of the world. Currently, 1 in 5 people who inject drugs worldwide is infected with HIV, the HIV virus, and 2 out of 3 with the hepatitis virus. In addition to that, repressive laws and criminalizations have prevented many states from putting in place what we know are the right things to do to prevent the harms from drug use. For example, harm reduction, needle exchange programs, or opioid substitute therapy. All of these are made difficult by legislation that itself rests on concepts of criminalization and prohibition. Criminalization is leading every day, everywhere in the world, to human rights abuses. As you've heard, of course, about the state-sanctioned murders in the Philippines, the death penalty that remains in a large number of states, detention centers in Asia, every day, everywhere. And of course, in most countries, and particularly here in the US, criminalization of drug use and possession has led to a wave of over-incarceration. For example, here I'm looking at the figures, the recent figures. Out of the 1.5 million people arrested in the US in 2015 for drug-related offenses, 83% were only about possession. Of the 650,000 arrests linked to marijuana law violations, 89% were only about use and possession. And in addition to that, these arrests and incarceration, as you know, disproportionately affect minorities, women. 70% of the women incarcerated in Latin America or in Southeast Asia are incarcerated for drug-related offenses. And in Europe, as in the US and everywhere, ethnic minorities and people economically vulnerable in the society are disproportionately arrested. In addition to that, as you would know, a criminal record is a huge impediment in life. It affects employment, housing, family life, education, exclusion from the rights of voting, driver's license. It can lead to separation of families. It is of a huge impact on everyday's life. Let me quote here Kofi Annan, a member of our commission, who recently said in Geneva, "Surely not, it's not the job of the criminal justice system to prescribe remedies to deal with public health concerns." And lastly, let me say that in this particular report, we also touch on something else, which is the right to privacy as a key element of human dignity. A state should only interfere with an individual's private life if there are good reasons for that. If the state can demonstrate that that interference is for a legitimate aim, that it is proportionate, that it is necessary. Now, millions of people across the world use drugs without causing any harm to others. So criminalizing them is unnecessary, it's harmful, it's not proportional, and to us, it undermines the right to privacy and the right to human dignity and personal autonomy. So that's why, as a member of the Commission, of course, but as a physician who's really witnessed the AIDS epidemic among people who use drugs from the very beginning, I hadn't a second of hesitation in co-signing on this report.
Thank you, Michel. Pavel, I think you made the two experience of criminalization and decriminalization, the consumption, so please explain us your experience.
Good morning. When we know that the prohibition doesn't work and causes enormous harms, killing people, in fact, being responsible for HIV epidemics around the globe, the fundamental question is what works? And there is several interesting experiences. One is from the Czech Republic. The first president of the former Czechoslovakia and later on Czech Republic, Václav Havel, submitted in 1990 to the Czechoslovak parliament the bill to remove all the criminal penalties for the possession of illicit substances for personal use. Parliament that time has approved the new bill, and all the penal sanctions were removed from the legislation. That time, I was a drug czar in the Czech Republic. That enabled me to introduce a well-balanced drug policy, which was nicely written, but whenever you design a strategy, like drug strategy or any kind of health policy, the question is how can you implement that? and how effective the implementation is. And we were successful enough in introducing good harm reduction, public health-oriented strategies, including the needle exchange schemes, including the HIV prevention programs, including the testing among former hidden population of drug users, which was not simply easily accessed. We introduced outreach programs for this hidden population in order to provide the hidden population with health and harm reduction services. We introduced the opioid substitution treatment programs. And in 10 years, the outcomes were quite astonishing. Even I was surprised as an expert in the field. So the Czech Republic had and currently has one of the lowest HIV seroprevalence rates among injecting drug users. We have one of the lowest mortality rates, lowest number of overdoses due to use of drugs. We have very low violent drug-related crime and overall drug-related crime. Certainly, there is interesting part of the story from the Czech Republic because 10 years later, the newly elected government where one of ex-drug user was very closely linked to one of the ministers, actually the most important minister, Minister of Interior, and he was a hardliner. And he convinced the minister to submit a new bill again to penalize the drug possession, and that happened. That happened after a long public debate and an expert debate. And unfortunately, actually, during the debate, we were able to push the government to start the continuous monitoring of the new punitive law. And we designed absolutely explicit criteria. How should we measure if the new punitive law, again, the criminalization of drug users, if that works or not? And in a 3-year study, the outcome was, again, astonishing. There was zero effect, positive effect on drug use of the new law, and there were severe, significant, negative public health, but also criminal justice impacts. So we decided again to remove the criminalization and the drug offenses for possession for personal use from the penal code. And this is the story of the Czech Republic, which is still one of the interesting examples of a good practice, but it's not alone. Because, for example, Portugal has removed criminal sanctions for possession for personal use in 2001. And in 15 years, the incidence of new HIV cases or AIDS cases at the end dropped 91%, 91%. Can you imagine what is the real public benefit of that? It's phenomenal. But also, Portugal reported 18% of savings, social cost, and this is mainly linked to keeping the productivity, not losing the job, because if you go to jail, you lose the job, logically. So the social savings are also fascinating, actually. Also the savings due to the fact that in 2001, Portugal reported approximately 15,000 drug-related crime per year for possession, actually drug-related crime per year. 10 years later, and this is still the same, it's 1/3, it's approximately 5,000. And this is Europe, but if you look at what happened in California since introducing in 1966 the decriminalization of cannabis possession, the savings are $1 billion per year. So the economic impact of decriminalization is enormous, but for me as a public health officer and for physician, even more important are health positive effects, looking at the morbidity and mortality, looking at the HIV and hepatitis epidemics. So what is the conclusion? There is no, looking at the scientific evidence, there is no zero arguments for keeping the punitive, prohibitive drug policies on the legal side. That means just penalizing, criminalizing the drug use itself, and certainly also possession of illicit substances for personal use. It's clear that the decriminalization itself is not enough, that that has to be accompanied by social and public health and harm reduction measures. Thank you very much.
Thank you, Pavel, for this experience. Cesar Gaviria, it's your turn now to speak about this painful experience of Latin America.
Well, Latin America is perhaps the region of the world where the issue of drugs is in the highest point. Probably that is happening because the Latin American cities today are the most unsecure and violent cities of the whole world. And most majors and most countries have identified that with the local consumption of drugs, not with international trafficking, but local consumption of drugs. Our last report concentrated on something that I want to remember some of you. It's the only thing that works are government regulations. Every prohibition has failed. The only thing that works in drugs is try to do as much regulation as you can, no matter what drug you are trying to deal with. It will be much better to deal with the crisis of heroin, working with doctors, that keeping the prohibition they have, which hasn't changed at all the problem they have now in the US. So our main conclusion of that report was the thing that works is regulation. For which drug? Any drug. It's the only thing that reasonably works. If you want to get one objective, the most important thing is to have regulation. Regulation of marijuana, of cocaine, everything. As much restrictions as you want, but with the participation of families and doctors and everyone. Prohibition is the worst policy and only takes out to big mafias and big business. The second thing I wanted to say is the big business doesn't come out of interdiction. The big business comes out of prohibition. It's incarcerating consumers. It's incarcerating farmers. What makes the business big and what makes mafia big is not interdiction. There is nothing against adopting many of the recommendations we do and keeping interdiction in place. And I say that because I come from a country where interdiction is critical, and probably we are the one or two countries more important for the US in the policy of drugs. Mexico and Colombia probably are the most important. And we do believe in interdiction, and we do interdiction. But that doesn't mean that criminalizing consumption or criminalizing farmers is a good policy. That's what makes the business bigger, and it's the bad use of resources, it's a bad use of public resources, and it doesn't take us what we want. We put the police resources what they should not be. We don't want policemen just in bars trying to find a small amount of marijuana to take a guy to a jail. That is a stupid and unuseful policy. So this time, the approach of our report is recriminalization. And we are talking about all drugs. We are not talking about just marijuana. We are trapped in a very difficult situation, and I wanted to tell you. And we had a meeting of the UN a few months ago. And the world is divided in a way that makes very difficult to have common policies. Why? Because if a third of the countries believe in that penalty for consumers. To find a common ground, it's just impossible. So those big efforts to try to modify the conventions and to have a global policy, that is what we have with the Global Convention, is totally wrong. It will take us nowhere, nowhere. And those meetings are totally unuseful. The follow-up, they are not recommendations, because you have to start to convince countries not to kill people because they are consumers of marijuana or heroin or whatever. It's impossible to design a reasonable policy. But even with that, we have been working in that very strange. And in Latin America, we have learned to do things. The reports of the Organization of American States, of CICAD about drugs are very reasonable. The recommendations make sense. The recommendations believe in decriminalization as a way. The recommendations believe in regulation as a way of dealing with these problems. And I think we have much more in common than with any other. The other thing is, one thing is the laws, and the other thing is the practice. What we have in the US and in Latin America is that police goes after minorities, after young guys, after black or indigenous people origin. And at the end, what you have is a lot of people in jail. Also, is white people consume as much drugs as any other. In the US, it's very clear that white people consume more heroin than black or Latinos or whatever. And that is even changing the expectation of life of the groups. But there is that idea that the ones that consume drugs are minorities. And that is, in the case of heroin, is totally wrong. It's totally wrong. The experience of the criminalization of heroin have been very good in Switzerland, have been very good in Portugal. And so we have experiences. We don't have to discover anything. In Switzerland, they just go to a public, if you are a citizen that poses no threat to society, you just go to a public hospital. They shot you the heroin, because it's very difficult to curate an addiction to heroin, and nothing happens. He keeps his life, his family, his job, everything. It's the same in Portugal. If they can help a heroin addicted, they just work with him. So it's not impossible to change the policy and to have a good policy in place. And it's possible in the US to do that. But here, that idea that everything that has to do with drugs is criminal is totally wrong. And probably the legalization of marijuana is the best demonstration that is totally wrong. It totally failed. I mean, this country seems to go conservative, but the plebiscites, the referendum on drugs, were all approved. Why? Because just people discovered that it doesn't work. It's a policy that is failed. It doesn't work. And it's much better if you work with other means than just trying to criminalize and to keep that idea that in the US, in some states and for some people and from some attorneys, marijuana is legal and from some others not. And there is a mixture of ideas which I don't know how they're going to solve in the long run, because it's very absurd. But anyhow, we want to point the idea that criminalization, even administrative sanctions, are not good. They are not as bad as criminal sanctions, but even administrative sanctions are not good. Why? Because at the end, they produce the same bad effects of criminalization. They just create a stigma of a person, make for him difficult to get a job, may destroy his family, creates a lot of problems that are for nothing. So it's much better to just decriminalize, make of consumption of drugs a health problem And that's it. And I want to move to the other side, the farmers. And I come from a country that has coca leaf plantations out of labs for producing cocaine, and we are the largest producer of coca leaves. You know, these people are very poor, probably the poorest of the countries. And why they plant coca? Because they are in regions where there is no other possibility, and because these people help them. But it's not because they get rich. You will never know a campesino or a farmer that gets rich. It's just a campesino, a very poor campesino. Probably it will only earn 80% of the minimum wage. So to say that those guys are criminals makes nonsense, and to destroy those cultivation of coca leaves with aerial spraying, with eradication by hand, when we see through the time, it's just throwing the money away. I mean, coca leaf has been always abundant, has no influence at all in the price of cocaine. No influence at all. All the value chain is in interdiction. It's from here. There is the value it creates is because of interdiction. So you destroy these. You spend $3,000-$4,000 to destroy a hectare of coca leaf by hand. And, well, that's a lot of money. Can you imagine what a campesino can do with that? Instead of taking the food from his mouth, if it's aerial spraying, it's not $3,000 or $4,000, but $10,000 probably, $10,000 just to destroy. And 3 years after that, you again have the coca leaf plant. So, I mean, what is that makes no sense at all. Spending a lot of money for nothing, because you get nothing out of that. Because the abundance of coca leaf doesn't change the market of cocaine. The amount of coca leaf of cocaine that enters the US from the Andean region is exactly the same every year. It's coming down a bit because people are moving to methamphetamines. But it's just that. So spending the money in an absurd way and making criminals out of a lot of farmers. And this is with no, and I want to say something, this is something with a lot of consequences. Before the second re-election of President Santos, there was a big earlier spraying in some parts of the country. Well, we had an agrarian strike that just put the government in serious problem. All the people from the countryside entered that strike, and it was terrible. I mean, the government was really in trouble just to do something wrong. That at that moment was with money of Plan Colombia. Today would have to be with the money of the government budget. So it makes no sense to try to keep doing that. The best thing is to give the money to campesinos and to help them to change and look for new alternatives. That is the only way of doing with that. Making of them criminals is total nonsense.
Thank you, Cesar. You entered into the discussion about the economic of the drug business, and I will give the floor to our economist here, Paul Volcker.
Well, thank you, Ruth, but I must say I'm the odd man out here. I'm not an expert in this area. I am not a public official. I haven't had to deal with it directly. But I also know you can't live in the United States these days without recognizing we have a big drug problem. And I have one quality that nobody else in this panel has. I believe I'm the oldest. And I can remember 50 years ago when President Nixon, in his first State of the Union message, announced the war on drugs. And a famous general was put in charge of the war on drugs. Well, it's 50 years later, and I think everybody kind of admits the war on drugs was not a great success. And there's a lot of turmoil in the United States, of all places, about this problem to a degree that has not been true before. We do have a big economic problem. Just keeping people in jail is a big economic problem. But it's a health problem. The economic side goes beyond just the people in jail, but we know about the social cost, the family cost, the employment cost, many other costs. So I'm glad to see the ferment in the United States. You already referred to the fact that here in a presumably very conservative election, the momentum for liberalizing marijuana seems to be continuing. Now, my little role is I'm a very conservative person myself. When I see what's going on, yes, we don't want to criminalize this. We want to decriminalize it. Shouldn't be blaming the people or taking measures against individuals for consumption that are destructive, socially destructive to families, destructive in many other ways. But are we ready to have a complete free-for-all? And it's hard to say that, I think, right now in the United States, where we seem to be developing new methods of distributing some of the more harmful drugs. But we're going to have a lot of experimentation. I see one of our planks of this organization is states must eventually explore regulatory models for all illicit drugs. They mean states around the world. I can interpret it states in the United States have all kinds of opportunities now for experimenting with what kind of regulation we want. You know, in some ways, the biggest drug we have is alcohol, but we don't prohibit consumption of alcohol, although it is a major problem, among other places, on college campuses all over the United States with binge drinking. We don't outlaw the students, but somehow we, in alcohol for many years, have found various means of some regulation. We don't sell it to children. We tax it, in part. Big question, what should we do about taxing marijuana in particular? Is this a way to get some kind of degree of control and some economic benefit and undercutting the market for the sale of marijuana by intermediaries? There's a lot to be done in this area, I think. But you can only welcome the fact that this degree of experimentation is going on, and the sensitivity to new drugs, illicit prescription delivery, or too much ease. That's not a criminal offense, but is there enough discipline in the medical profession in terms of drug behavior? Many questions in this area. How about access to children? Do we really want marijuana in candy, marijuana in cookies? Do we want marijuana around in its most severe types without some notification that this is a more dangerous type than some other recreational uses of marijuana? All kinds of questions, I think, need an answer. But I think hopefully we're on the way to getting those answers once we clarify a little bit that we're not going to penalize by criminal action and put in jail or other means of controlling the consumer. So let's look at regulation and what is the appropriate form of regulation rather than a complete free-for-all. I can't resist telling a little story where this influenced me personally. I was asked to address a group of maybe 100 people or so because they knew I was in this group about what to do about drugs. And I repeated the story you hear here less effectively, that the time has come for decriminalization, but I think we need a little concern about how we regulate it most effectively, how we tax it most effectively, whatever. I got finished with my talk. A grandmotherly type, I interpreted her as grandmotherly, came up to me and gray hair, a little irate, and she said, "I don't believe a word you said." And I thought I was going to get a tirade against liberalization. She said, I come from Humboldt County, California. We grow the best marijuana in all the world, and I don't want the government messing around with our marijuana. Now, I think she was a little extreme the other way. I do want the government maybe to consider what to do about their marijuana, but I'm not going to stop that grandmother from growing marijuana in Humboldt County. So I welcome the ferment in this area. We haven't got this problem licked by any means by 50 years of war, but I think we are reaching a point where perhaps we recognize the cost of the war and can find more reasonable ways of dealing with it. And when I listen to the other people on the panel that know so much more about this than I and have directly dealt with this problem, I can't help but feel some sense of encouragement.
Thank you, Paul. You have understood that the Global Commission on Drug Policy has a whole program of reforms on different aspects: public health, penal responses, and regulation. We are now concentrated with this report on the problem of the punitive answer to the drug consumption and to the drug to the different actors, non-violent, little petty actors of the chain. And I will just finish before giving you the floor with our 5 propositions you will find off page 29 of our report. First of all, and that's very clear, states must abolish the death penalty for all drug-related offenses. And when you think that 13 countries in the world still have mandatory death penalty, that is that the judge has no discretion, for instance, to consider the special situation of the offender, it is really something that is beyond all the human rights law and the commitment taken by the country that death penalty, if it is retained, must only be applied for the most serious crimes, and drug-related offenses are not such serious crimes. Second, states must end all penalties, both criminal and civil, for drug possession for personal use and the cultivation of drugs for personal consumption. Third, states must implement alternatives to punishments, such as the aversion away from the criminal justice system for all low-level non-violent actors in the drug trade, such as those engaging in social supply, drug couriers, user dealers, and cultivators of illicit crop. States must recognize that a number of people engaged in these acts out of economic marginalization and implement alternatives to criminalization that uphold international human rights standards. Fourth, UN member states must remove the penalization of drug possession as a treaty obligation under the international drug control system. And fifth, states must eventually explore regulatory models for all illicit drugs and acknowledge these to be the logical next steps in drug policy reform following decriminalization. If I may just add a personal experience, I was for 10 years a Minister of Health in Switzerland and in charge with the narcotic implementation of the narcotic law. I am very proud that we could, as Pavel said, save lives, react in front of overdoses, treat people with substitution therapy, even with medical heroin, give them the means to protect themselves with harm reduction measures. I was also proud to see my country not depenalized, not decriminalized, but introducing civil punishment, civil fines for consumption, but this is not enough. I still think that I was living in a paradox. On one side, having the prohibition as a general rule, on the other side, having the moral obligation of helping people with all forms of support that are consuming something that is illegal. The only way to overcome, at the end of the day, this paradox is regulation. But it is clear that many steps that can be made just to save the situation of the people, to integrate them in the society and so, are to be encouraged. And this is also one of the activities of the Global Commission on Drug Policy. Now, I am very happy and curious to hear your remarks and questions. There is a micro circulating, and please, if you could also announce your name and your media, that would be very interesting for us.
Yes, thank you. Hi, my name is David Hodes. I'm a member of the Press Club and Deputy Chair of the Press Club's Newsmaker Committee. And this question is directed to Mr. Volker. With the legalization efforts that's happened in the United States just recently, now that 20% of Americans in this country have access to adult use marijuana, do you think that that's a signal to the international community that these efforts in the United States can now affect what's happening in the world community regarding legalization efforts and more drug policy reforms?
Well, I interpret this, I think, as the United States catching up a little with what's going on in parts of the rest of the world, not the whole rest of the world. But you have people on the panel here describing hopefully successful efforts in Europe or in Latin America to liberalize as part of an international wave. I would like to think of it as a wave toward a more sensible drug policy. But you certainly have this surprising result in the United States compared to what it would have been, say, 10 years ago, where it was shocking to think of decriminalizing drug use. Now it's quite accepted. And of course, for years, people have not enforced in many areas of the country rules against marijuana anyway. But it's now becoming an accepted fact, I think, in most areas. And I think we will get experimentation with regulation. You hear stories coming out of Colorado or elsewhere of some excesses, it seems to me. We don't do minimal things to keep it out of the hands of juveniles. Maybe we ought to worry about that a little more. So I think we're in a period of not success, but experimentation, but I'm glad to see the experimentation.
Yes, I think that is one interesting thing to talk about the situation in which the U.S. is at this moment. You know, the conventions at some point accept you don't have to criminalize consumption. Really, if you have an internal legislation that does not criminalize consumption, you are not obliged to do it. That is not something that the convention, but there is one thing that the conventions totally ban, and it's acceptance of cultivation of marijuana or any other poppies or. There is a total ban to do that. And although the government of Uruguay, that did a policy similar to that of the US, established a government monopoly, something that seems compatible with the rules. In the case of the US, they made out of the plantation of marijuana a business. So it's impossible to imagine something that violates more the conventions than the cultivation of marijuana in the US. So it's not going to be easy in the years ahead for the US to be in the very tough position they were in the meeting of the beginning of this year, in the UN saying, we cannot touch the conventions. The conventions are the center part of the whole policy. Yes. Easy to say that when you are violating every one of those things. So at some moment they will have to be flexible, to accept that countries have the right to try different policies. They don't need to have the same policy, that they can have different policies, and that this idea of having conventions that cover with detail the policy of all countries of the world is not practical, it's not intelligent, and it's not possible. Because the conventions are based in one thing. We are going to live in a world free of drugs. That was the intention 50 years ago, and is the intention today. And we all know that is totally false. It's an utopian thing. It's moral. It has nothing to do with practical things. We will never live in a world free of drugs.
Thank you.
Hi, thank you very much for doing this. My name is Beatriz with EFE, Spanish Newswire. And I wanted to ask you, you mentioned in the report that there are 33 countries who have death penalty for drug-related offenses. Could you please talk a little bit about that? Who are the people who receive these death penalties? And also if you have data of how many people have been executed in the last years. Thank you.
Very severe doing that. The countries that you have in the report the list of.
It doesn't say how many people have been executed. I didn't find that.
I think I cannot just give you this information like this out of the pocket. And you know that in some of these countries, the information about when the people are executed and so on are very vague, and the country which is the country with the greatest number of executions, nobody knows how many there are. I am speaking about China.
But there is one thing clear, that this year in the Philippines, thousands
Yeah.
being killed just by the expressions of the president, say, kill anyone who is consumption of the drug, consumer of drugs. So, I mean, those are the type of things that are really, there are still countries that think like that.
Another question, yes, please.
Hello, my name is Haley Flynn, and I'm from an organization here in Washington, D.C. called HIPS that works on drug policy issues. And I'm just specifically curious, the question is directed to Mr. Bem, about the process of criminalization and decriminalization within Prague itself, and when you were sort of removing the criminal penalties once again, which arguments were most effective in actually achieving that? And was it, you know, the ones related to health, or was it more rights-oriented ones? Because I was also very intrigued by Mr. Kazatshin's comment about the right to privacy and human dignity and how those arguments can be powerful as well. So I'm actually just curious what has gained traction and what has worked well. Thanks.
Thank you very much for this question. Actually, all you said. Human rights definitely at the first spot. We've seen, even after the reversion of the drug-related offense for simple possession, even though in the country where the 10 years history of all these positive effects of decriminalization, of all these so-called moral or ethical human values based on the fact that this is just, and this was actually the fundamental sentence said by President Václav Havel, who said, this is a human right. And nobody is going to tell me as a president what should I do if I should smoke or drink, if I should smoke cannabis, or if I should smoke nicotine, tobacco. So it was interesting. So the human rights were very much at the beginning of the Czech story. But at the end, it was not enough. Arguing and convincing with scientific evidence showing the prevalence rates, the number of new HIV cases or hepatitis C cases, number of new 16 years old adolescents just using. All this you would expect just introducing the punitive approach should decrease, because why you would do so? You simply wish by the wishful thinking to stop the drug use with all the consequences there. But we set up something like 28 explicit hard criteria. No out of these 28 hard core explicit criteria did not show any improve after 3 years of introducing the criminalization. So then we just went to the government and went to the parliament as an experts and asking them, well, you decided to criminalize after 10 years of decriminalization experience. And we said, okay, but we have to put in place the scientific evidence monitoring process. And we did. And at the end, this is 3 years, the game is over because the data did not show any positive effect, but on the other side, show a negative impact on the health and social side and the criminal justice system. So then we start the process of convincing parliamentary members. That time I was a member of the parliament, so it was a good luck in a certain, from certain perspective. And we reverse the penal code back to the decriminalization, and we are happy to do so because we did not see HIV epidemic. We had quite a lot of hepatitis C from the old totalitarian regime, communist regime, past, where it was labeled that Czech Republic or Czechoslovakia has no drugs, but that was not true. We had. So it was nicely to see after 15 or 20 years that the HCV seroprevalence just got under the control, just decreasing the number of the incidence rates, the new cases, but also improving the health of those who have been infected already, because even the super infection making worse the case, the individual case. So there was a lot of positive effects at the end.
Thank you. Yes, Cesar?
Well, within the Commission, this has been a long discussion, but I want to start saying that at the beginning of our work, there was one thing for clear: all drugs are bad. It's not that some drugs are good, some are bad, no, all drugs are bad. So what we are looking is for policies that are less harmful for society. It's not that we are accepting that there are drugs that should be used or that are good for use. No, drugs are bad, anyhow. And I say this because in our societies, libertarian thought is not that of the majority. I mean this: I have the right to make damage to myself. That is a libertarian point of view. Is my health, that is my problem. I mean, many people do not accept that argument as something acceptable. The other idea, it's the right to privacy, the right to dignity. I mean, those type of approaches are not of the whole population. It's better if you move from the point saying all drugs are bad. Let's see how to deal with them in the way that is less harmful to society. And I want to put the example of my country. What happens with drugs? Yes, the conventions of the UN are important, but we have to care about corruption. We have to care about violence. We have to care about a lot of other values that are much more important than the UN conventions. So don't ask us that the conventions are much more important than having thousands of killings of people. I mean, it's a totally different thing. So I think the approach of most European countries, that the policies that are good are those that are less harmful, is more practical, even for American thinking, than the principle policy, the policy based on principles. No, I think that approach of the policy that is less harmful, that avoids killing, that avoids homicides, that avoids more people in that avoids more corruption of the institutions. I mean, that is a better approach to these problems than the policy based on principles.
Thank you. I can just add perhaps from my experience in Switzerland, because you ask how to convince also. I mean, when a family is in the dramatic situation of having some of the beloved one being really addict and falling into or slipping into clandestinity and being in contact with the black market and so on, and losing job and having a divorce and so on. I mean, this, or a young guy who is no longer integrated in school or professional vocational training. I mean, often these parents are really lost. They don't know how to deal, because there is, I would say, yeah, in a certain sense, too much love. They are always torn between making too much in favor of these people and making too less, chasing them from home. So I, as a minister, I received really the call of many of these families saying, please, you take care of our people. We don't want them to die. We want them to be cured or to find a balance. But we are no longer able to do that. If you are criminalizing them, if you are putting them in, pushing them in this margin of the society. So I mean, this argument was a very important one. The second one was just the argument of the people who are at the front. The street social workers, the nurses and so on, who saw the misery of in this field of hidden consumption. And they said us, okay, I know that if I give a syringe that is clean, I will help somebody to avoid a contamination. So I mean, for us politicians, it was really the experience on the ground of people who had professionally, but also personally, the bravery to go into the community of drug users who told us what to do. And we were just a relay of this message, and I think it was a message that was really understandable by a broad opinion. Let me just add something. We have the chance in Switzerland, as some of the states here, to have a lot of ballots. We voted on either on local, cantonal, state, or federal level, I think 15 times in 10 years, and most of the results were positive. This had the advantage that we had really to explain what we were doing and what were the results, as the Czech did in their parliamentarian discussion. And this can convince people that this is the way to go. Another question?
There is an online question from Francie Dieppe of the Pacific Standard magazine. Wouldn't decriminalization or legalization increase drug use? And if decriminalization increases problematic drug use, how should countries deal with this?
There is absolute no evidence that there is a relationship between decriminalization and the prevalence of consumption. We have very different figures. If I retake the example of Europe, you can just take, for instance, two neighboring countries, the Netherlands and France. Netherlands has a system that allows the consumption of marijuana in coffee shops. It's not really totally regulated, but it is a system where the consumer cannot be criminalized for that. And they have in the Netherlands a lower prevalence of consumption, not only of cannabis, but of all other substances also, than France, which is one of the most severe countries in Western Europe. So if you take examples, you see that there is no direct consequences. And the example we have show that it is possible through prevention, through information, through other measures of public health to avoid an explosion of consumption.
We have a lot of scientific evidence that there is no link between decriminalization and the extent of drug use. But this is something different than the relation between legalization and the extent of drug use. Decriminalization doesn't have anything to do with legalization of drugs. Therefore, we are very careful, and in fact, we are not using the word legalizing or legalization. Therefore, we are using the word drug regulation, because we see a lot of public health harms caused by the use of alcohol or tobacco in unregulated market context. Then we see a much less in certain levels of regulation when it comes to alcohol or tobacco. Certainly there are many models, some of them are more effective, some of them are less effective. So therefore, we are, and the last year report was on the regulation of drug markets. And this is the key, even just behind or implicitly hidden in the 2016 report, that we really look at the regulation.
Other questions? Yes, please.
Thank you. I'm David Borden with the Drug War Chronicle newsletter and organization StopTheDrugWar.org. President Gaviria noted how different the views are in different countries and parts of the world on what drug policies they're favoring. This makes the current language of the drug conventions more problematic, but also the process for trying to amend these conventions more difficult. Are there paths that one can imagine moving forward for eventual treaty reform or short of reform for managing this conflict? And what advice can you offer to states that are considering attempting drug regulation?
I think the most important is really to make reform advance on local and regional levels, to bring this evidence that other policies are more efficient and more humane. Without the possibility to make this demonstration, and Paul spoke about experimenting, and that is a very important word. When you want to reform something for the best, you have first of all to prove that you can do better things, and you have also to identify what is really wrong. We are at the stage where we can say what is really wrong. That's criminalization, that's the price for people who need medical support. But we are also now in a phase where we are beginning to experiment regulation. And I think this is the step that will bring the world community to reconsider. But it's a long path.
Yeah, just one point on this is it's the view of the Commission, and you may have read our press releases after the UNGAS in April this year. It's the view of the Commission that one of the things that the UNGAS has shown is that the consensus around prohibition and prohibition law enforcement as being the policy is broken, and that, as you said yourself, opinions across the globe are totally different. So it is our view that we have to move to regulation, but we have to start pragmatically, working at the local, at the city level, at the sub-regional level, at the regional level, have this or here or there national new experiences, and progressively the evidence will prevail. It's our view that in the long term, there's no way that we could do without reforming the convention system. But it will take a long time, and we shouldn't wait for that to experiment and work.
And strangely enough, the US is showing the way. Yeah. Now, experimenting regulation which is not online with the convention.
Sergio Gomez from El Tiempo of Colombia. Precisely about that way that you were talking about. Under President Obama, we saw states that came forward and approved marijuana for personal use and started regulating the business. And he gave instructions to Justice Department to not prosecute marijuana offenders, for example, in those states. Are you fearing a backlash now with the Trump administration, where he is talking about, being the heroin epidemic and stuff like that? Do you think that we're going to reverse that tendency of the last 8 years?
It's difficult to know what, in French, somebody said, I think, that prophecy is most difficult when it is dealing with the future. So it's not very easy to know. I think there are two tendencies. One tendency is a more ideological tendency, fact negation that might really also bring a backlash here. On the other side, the crisis of opiates here is national emergency, and in this sense I would say that the necessity to change something is so big that it might be also the departure of a bipartisan proposal, of bipartisan collaboration on the ground in the parliament, and to change the steps. The over-incarceration is also, as you know, a financial problem. I mean, what sense has such a large incarceration rate as the United States? I have to repeat once more, 5% of the people in the world are living in the States, but 25% of the people being in jail or prison are living in the States. So, I mean, there is a huge imbalance in the penal system here, and I think it is recognized not only for human rights reasons, but also for economical reasons. You are a prophet for the future?
Yeah, no, I think it will be useful for the U.S. to look at the experience of Switzerland and Portugal, because it's a totally different approach than prohibition. And one thing important in Portugal is people didn't move from soft drugs to strong drugs, but the opposite. People move away from strong drugs and started to move to soft drugs. And that happened with morphine with heroin in Portugal. And the second thing, that experience of Switzerland, or trying to isolate those people that are good citizens and helping them with the health approach, it will be very useful in the US. Instead of criminalizing anyone that consumes heroin, it will be much better to do what the Swiss do, to try to find all the people that use heroin but are good citizens and can play their role in society without being penalized. So I think it's time to look to those experiences instead of waiting people to revolt. That is what happened with marijuana. People just revolt against their own policy. So instead of waiting to that, it will be useful to look to those experiences of Europe that are really good.
In fact, the provision of opioid substitution treatment in Switzerland, including the heroin substitution to heroin users, is, in other words, experiment with heroin drug-related market, black market. Because we are here talking about the experiments in cannabis regulation. But in fact, this is extremely effective, surprisingly effective experiment with the black heroin market.
Yes, perhaps just to explain that, we had a problem similar to the States 20 years ago with open scenes, needle parks, where the people were just abandoned and facing really health harms and violence and death. And for the people who were really so dependent on heroin that they were not able to follow any other treatment and were living in these needle parks, we offered, with 5 years of scientific monitoring, we offered them the possibility of receiving medical heroin produced by the state in day clinics where they can come 2 or 3 times a day to receive the substance they need. And also here, as the example of the Czech Republic in general, the consequence of this was a dramatic decrease of petty criminality. I mean, it quasi disappeared for these people. A better general health, not only in relation with the drug itself, physical and mental, balance in life, some of them still at welfare, but with housing and the possibility to have a dignified life, and for some of them also to find real integration with their own job and becoming really independent. Well, it was also necessary, I have to say that the health insurance take over the cost of this treatment, and it is clearly a treatment. That means that the most dependent clients of the heroin deal disappeared. There are still people who are consuming black market heroin, but they are little number. They are the most, as I said before, the most dependent, the most enslaved consumers were freed from the black market and from the criminal organization.
Just want to add 2 things, because we've been talking a lot about heroin, a bit about cocaine, a lot about marijuana. But if you think of regulation and sort of building on your question, regulation is also about controlling the quality of what is on the market and what comes to the consumer. And this, to us, is key for the increasing use of methamphetamines and synthetic drugs. So since we have no equivalent of opioid substitute therapy for these substances, I feel it is urgent that we experiment with regulation to make sure that the consumers meet quality products and safer products when they consume. And second, regulation is also an important, to answer your question, an important factor to prevent what we see now in the US and in Canada as an epidemic of prescription drugs, because regulation is also about controlling how the pharma influences the prescription, how the pharma can or cannot advertise, and how doctors are disciplined to prescribe. I think in Western Europe, we have as good access to medications for pain killing as in the US, but we have no equivalent of the opioid epidemics that you see here or in Canada, because we have a regulated and disciplined system. So I just wanted to add that as we go into that discussion on regulation.
We are coming to a last question, I think, for time reasons. So Khalid?
An online question from Will Godfrey at The Influence. Is the Global Commission fully supportive of the ultimate legal regulation of all drugs? And if so, is the new report's emphasis on decriminalization due to the fact that it is a more realistic immediate goal?
I think the answer, I believe the answer is yes and yes. So as all of us said, we're talking about all drugs. And yes, we think that we strongly believe that decriminalization is the next and urgent step to take.
I would just add something, that is that in a regulating market, the worst drugs disappear. It is in a wild market that you can find things like the experience Michel made in Russia with a drug that is more or less killing the people in a few months, crocodile. It is clear also that in New Zealand, for instance, the idea and the new bill, which is not implemented at this stage, but just a decision to regulate the market of psychoactive substances, has reduced on the black market, still black market, the wild or open market, the number of substances, and those who were eliminated because the producer hope of regulation, of registration of their product, those who disappeared were those who had no chance ever to be registered. So I mean, market is chasing the bad substance. And I think the prohibition of alcohol in the United States shows a very good example how prohibition was created a market for the strongest and the most dangerous substances, alcoholic substances, chasing the more cheap and less dangerous one. One last question in that case.
I would like to know what was the name of the program as far as was the medical heroin being distributed, and what happened to the program?
C'est sur le programme de prescription d'héroïne. Ensuite, tu peux lui répondre en privé.
I will answer afterwards, okay? Because I think I gave some explanation. If you want more, we can just do it now, okay? Thank you. Thank you for attending this press conference.